Now, let me do the intro first, and then you can share.
Let me just, okay.
Okay, I think we can start.
Okay. Good morning, everyone, and welcome to today's SADA webinar aimed at educating members of the public. Today, we have the pleasure of hosting Mrs. Elna van der Ham, who will be enlightening us on how to make the best choice when it comes to the various oral health care products that you see on the market. Elna is an independent oral hygienist with expanded functions, as well as an international speaker. Welcome, Elna, and thank you so much for joining us today.
Thank you, Tanesh. It's a pleasure as usual, and thank you for the opportunity to just share some information. I think a lot of people always have questions about which products they should buy, and we hope to just shed a little bit of light on that for them. Okay. Do you want me to share my screen?
You can do that.
Okay. Oh my goodness, why is it now on the last page? Okay. So I would like to speak to you today as the public out there to, when you go into the shops, always keep these advice or this advice in the back of your mind when you're choosing a product. It's 100 products in the shop that you can choose from, and which one is always the question. So I'm going to start with the basics. So basic oral hygiene needs is always a good toothbrush. And you can see in my picture that there's, different designs, different sizes. And by the way, if your toothbrush looks like most of these brushes where the hairs are splayed, then they should have been in the dustbin a long time ago already. I put it in for a specific reason because this is often what I see when I visit friends or family and I go into the bathroom. This is what I see. And if a toothbrush like that is already causing damage to your tooth structure and to your gum. So please remember that when your brush starts playing, it's time to chuck it out. Okay, so the different sizes, the different designs, different brands, it doesn't really matter. I'm going to speak to you about what is a good toothbrush. So a good toothbrush design is always soft bristles. And many bristles in the head so that you have good surface contact. And of course, soft is good because you don't want to cause damage to the hard and soft tissue in the mouth. A smallish head is recommended for obvious reasons so that you can get to the back of the teeth. A lot of people choose very long and big toothbrushes because they end up scrubbing their teeth and that causes damage as well. So the smaller head will give you access specifically to the posterior of the mouth where it's difficult to reach areas. Your ergonomic handle design for an easy grip is also important. And of course, everybody's hands are different sizes. So find one that is suitable for you and also age appropriate. So when you have children, buy smaller brushes because their mouths are a lot smaller. So choose wisely when you go into the shop to buy a brush. I'm going to go just quickly back to the brushes. When I ask my patients, which brush do you use? It's normally the one my wife buys. And I think it's important to advise the person that buys what your needs are. So dental floss is very important, or should I say interdental cleaning is very important, and dental floss is one of the ways that you can do interdental cleaning. So floss is needed to clean about 30 to 40% of your interdental spaces. And if you are not doing flossing or interdental cleaning on a daily basis, you leave 30 or 40% behind. So you can imagine when you are leaving something behind each day for 365 days, in the end, you will have bleeding and inflammation in the interdental space. So they've done a little bit of a suggestion for us to make it visually for the patient. So if you join together all the interdental spaces, it will be in your mouth. It will be the size of an open wound, the size of your hand. if it was on the rest of your body. Now, if you had an open wound on your body that size, you would certainly rush to the doctor, and yet people accept it in their mouths. So it's very important. So your excellent daily habits save your teeth and gums. So do the interdental cleaning every single day. So the other option for cleaning interdentally would be with interdental brushes. It's a very effective way of cleaning the spaces in between. The design and the anatomy of our teeth, the anteriors and the premolars and the posterior teeth, are all different shapes and sizes. And this interdental brush is actually a very good way to reach specifically in the molar areas where your concave root structure makes it difficult for floss to clean there. So it must be instructed to you how to use it by either your dentist or your hygienist, and the correct technique is very important. The size of the brush that you use is critical. If it's too small, it's not effective. If it's too big, you're obviously causing damage to the gum, and you can cause damage to the tooth structure as well. And it's once in and once out. Patients do it sort of this motion, and that actually causes a lot of damage to the root structure. So be careful, use it correctly, very effective, but to be used in the proper manner. Your toothpaste, there's so many different brands. You can see just by the top picture there. If you go into the shop, you say, which one should I buy? So I think it's always good to get advice from your dentist or your oral hygienist. They have different ingredients for various users, and that's why you need to ask a professional so that you can get the advice what you need in your mouth, and that is different for each person. One of the most important, I think, criteria when you choose a toothpaste is to make sure that it's not very abrasive. So there's something called an abrasive index with toothpaste. Unfortunately, it's not on the boxes, but you can certainly go and check on the internet which toothpaste has what abrasive index number. So your abrasive index will go from 0 to 70 is low grit, from 70 to 110 is medium grit, and from 110 and above, I don't think you should even buy that. So always know that if something feels very rough in your mouth, don't continue using it. There are some toothpaste on the market that tells you the instruction, because it's abrasive, only use twice a week. But of course, patients don't read the instructions, and therefore they use it daily, and then they end up with sensitivity. So you can try and resolve one issue. You want to get the stains off, but then you end up with sensitivity. And that's why you need advice that is informed advice, that you know exactly what you need. So just a little bit of a fun fact. The world's oldest known formula for toothpaste dates back to the Egyptians, where they used rock salt, mint, dried iris flower, and pepper into a powder that they cleansed their teeth with. And I wrote here, it sounds like a bestseller for today's biological market. So be careful of making your own toothpaste. A lot of people do. And I've seen it in the chair where people make their own things and they end up with abrasive, damage. So be careful when you do this, just a warning. So cleaning the tongue, a lot of people don't clean their tongues, and I think it's a very important part of your routine. It should be just that you brush, you do interdental cleaning, and you brush your tongue, or you clean your tongue. So you can do it with a brush. You get tongue brushes, you get tongue scrapers, as you see in the picture here. The correct technique can also be shown to you. There is a gag reflex that comes, when you do the tongue. But I think it's important when you go to your dentist or hygienist, they can show you how to do it, that you don't get this reaction. The tongue is often a forgotten part of the mouth, because people just brush their teeth. And the tongue contains papillae, and the plaque bacteria lies within between the papillae. And so often when you have a bad taste in your mouth, it actually comes from your tongue, not so much from your teeth. And the tongue has receptors for your different taste sensations. Your taste buds actually regenerate every 2 weeks. And so for us to clean the tongue is as important as brushing your teeth, because you can have clean teeth and you can have a tongue full of bacteria, and so your mouth is actually not clean. So there could be transfer taking place. And we know now that bacteria travel. And so what is on the tongue doesn't stay on the tongue necessarily. So find out what you would like to use, whether it's a brush or a scraper. You can even use an old spoon. It's just whatever you feel comfortable using. The mouthwash debate, of course, is always the question that arises: is it really necessary to use a mouthwash? And which one should I buy? So once again, I think it's on the advice of your professionals on which one you think you should use. And sometimes there are conditions that arise in the mouth where you have an ulcerative gingivitis, which is an inflammation in the gum. Then you certainly would need some intervention. Also, post-operatively, when you've had a surgical procedure, they will give you a chlorhexidine-based mouthwash that you can use for 7 days because you can't brush. So one understands that there are times that you're going to need mouthwash, and then certainly we would advise that you use it. But do not continue using it, because there are side effects when you continue using it, because you destroy all the normal flora. So only a week or two on the recommendation of the professionals. And, but then if you want to do a daily mouthwash, I think it's important to find the correct one again for you. And the correct one can be salt water. A lot of people love salt water because they don't necessarily want any chemicals in their mouth. So then I would say just use a teaspoon of salt in a cup of lukewarm water. That is very good. It draws out swelling, and it's also good antibacterial. There are hydrogen peroxide mouthwashes, which is very effective in certain cases. And then, of course, there's the alcohol mouthwashes. So that's a big debate. And I think there has been some research indicating that one should avoid the alcohol in the mouthwashes. So once again, whatever is correct for your mouth. And the important thing is to ask the question when you buy a mouthwash: does it destroy my normal flora? So what is your best practice for oral care? It's always to seek professional advice from your preferred dental office. And what is your oral health needs? That's important. Don't follow fads on the internet, because if you go onto the internet, you can find a million people giving you different advice, and all of that advice is not always correct. So be careful that you don't follow the latest trend. Please remember that your health of your mouth comes first, and do no harm should be your consideration when you're embarking on a product selection. So the thing in the back of your head should always be to preserve your teeth and gum tissue, because once you've lost gum, once you've lost enamel, it's not easy. Your body doesn't make it again. So you have to go into a restoration program, and you'd rather avoid doing that and preserve your natural tooth and gum. So what does excellent care look like? Brushing twice daily with a non-traumatic toothbrush, whether it's manual or electric or sonic. And the important thing is not just to brush your teeth, it's important to brush until they're clean. Because I always say that tooth brushing is not synonymous with tooth cleaning. A lot of people brush for half a minute, So they've brushed their teeth, but they not necessarily have cleaned it until all the surfaces are free of bacteria. Once a day with your interdental cleaning is imperative. And I think that's where most people slip up. They brush their teeth, but they don't do their interdental cleaning every single day. Your tongue cleaning, and then of course mouthwash if it's indicated. So it's going to be a 5 minute of your day, and most people tell you they don't have the time, which is of course not true, because they'll watch a series for the whole night and then they actually say they don't have time to brush their teeth. So incorporate it into a time of day where you feel that you can take that 5 minutes aside. So what is the criteria for your selection? It should always be acceptable to you. I can recommend products, and if you don't like it, you will never use it. You will throw it in the drawer. So it must be acceptable to you as the client or the patient. It must be effective, otherwise why bother? And it must be atraumatic to the teeth and gums and to your systemic health. You must remember that the oral cavity underneath the tongue sublingually has a great absorption capacity in the soft tissue. And so whatever we put into our mouth doesn't stay in your mouth. It actually gets absorbed. So always remember that when you make a selection. So these are the three criteria that you should always keep in mind when you choose a toothbrush, when you choose your interdental cleaning, and when you choose any rinses. So what is the best of the best practice? It would be a sonic electric toothbrush. Your sonic brushes has the capacity through the sonic waves to actually go underneath the gum, which is very unique in terms of the brushing, because your manual brush and a lot of the other toothbrushes actually does not have that capacity. So I prefer, and if a patient can afford it, literally to buy a sonic toothbrush for them so that they have that ability to go underneath the gum a little bit. It works on a hydrodynamic effect, so it actually forms a paste with your saliva and with the toothpaste and with the vibration of the brush, and that actually is what cleans with that pressure underneath the gum. Your quality interdental brushes should have a surgical steel shaft and soft bristles. So when you select, make sure that you have that, because if it's not surgical steel, if they bend, you can use them once and you can throw them away. And if you have implants in your mouth, make sure that you have plastic coated interdental brushes so that you don't scratch your dental implants. Appropriate for you dental floss. If you're not using interdental brushes, different tongue tools according to what you prefer. You also get water flossers, your aqua flossers, for very specialized needs. So if you've had implants, if you have orthodontic brackets in your mouth, then it's very nice to use the water flossers. Sorry. You actually are able to remove a lot of the debris around the implants and around the braces. Your specialized brushes for orthodontics and implants is necessary if you are going through treatment. Ask your dentist or your hygienist, because that will assist you to keep it very clean and healthy around the tissues while you're having implants. And then, of course, mouthwashes if so indicated by your dentist or hygienist. It sounds like a lot, but it literally takes a few minutes. So it takes a brushing 2 minutes. Your interdental cleaning should take a half a minute to a minute. And then if you're using any mouthwash, it's a minute. So you can basically put 4 minutes aside. Then there's the whole debate about chemical versus biological. So you can choose a plastic toothbrush versus a bamboo toothbrush. So that's personal preference, really. And then there's the whole fluoride or hydroxyapatite debate. And if patients do not want fluoride, then you can certainly give them an alternative, which is hydroxyapatite. It's bioidentical to tooth structure, and it works really well. There is plastic coated, the floss is plastic coated. So there are people who do not want any of the plastic coated floss, then you can go to the bamboo flosses as well. So there's actually been a study done and in cardiology where they found plastics in arteries. And so if we can minimize the plastic content, it is, of course, to our benefit as well. So then it's the alcohol, chlorhexidine, iodine, hydrogen peroxide, and salt water debate. And that is really just what you prefer and what your needs are. And then the same with the tongue scrapers. You also get the plastic and metal tongue scrapers. So you make the choice as long as you're not causing any damage. And then to remember our beautiful planet, to dispose of your dental aids in the correct manner. If I go down to the beach and literally in a 5-meter radius, I'm sure you'll find one of those little single-use floss picks. You find gloves, you find masks, the toothbrushes, toothpaste tubes, and it's just the correct thing to do is to dispose of it properly. Recycle if you can, and avoid single-use items. That is one of my biggest criteria when I instruct a patient, is that they do not use single-use items. So be mindful. Mindful consideration of the selection for your needs, mindful of the effect that whatever product you're going to use will have on your mouth and your body, and to be mindful of your environment and be present in the moment. And it's the key to making healthier choices. So my picture says mindfulness isn't difficult. It's just that you need to remember to do it. And that's I think where we all fall short. We go into the shop, we grab something from the shelf, and we run out. And so, yeah, just to be mindful in the process of selecting your tools that you need to keep an excellent oral health protocol. So thank you.
Thank you so much, Elna. That was really informative, and I'm sure a lot of members of the public will now have a much larger overview, I think, of the products. When you go into Discount and you look at the aisle, and there's like 100 products staring back at you, and you almost think, okay, where do I start? So at least now they have a clearer picture in their minds. Maybe I could just ask like a little bit of a controversial question. So if you go on scrolling on social media, just generally on the internet, there's a lot of these fads that pop up, and one of them that has come across my page quite recently is about oil pulling. I don't know if you've heard about where people take like coconut oil and they swish it around in their mouth for about 10 to 15 minutes, and it's supposed to have these magical benefits. What are your thoughts on that?
Okay, so if you go, oil pulling is actually an Ayurvedic medicine practice. The basis of it is really that your different oils have antibacterial properties. And so, yes, if you do the oil pulling, and I've got a few patients who do oil pulling, and I must say the oral hygiene is good. But of course, you can say, okay, so they have to stop the oil pulling to see if it makes a difference. So if you go onto PubMed and you look for research, there is 1 or 2 papers on it, on oil pulling, but it's not a widely researched item. So, but if a patient enjoys using it because of the antibacterial properties, because your oils all have different health benefits to it. So if a patient wants to do that, I don't see a problem with it. You have to do it though for 10 minutes, keep the oil for 10 minutes in your mouth. And that's, I think, where most people will fall short because
Mm.
they just don't. I mean, they complain about 3 minutes. Imagine
Yeah.
saying we walk around with something for 10 minutes. Um, but also, again, if you do the oil pulling, do not spit it out into your basin because you will block up your basin.
Ah,
And also, I think just, once you've done the oil pulling, just spit out into a piece of paper and throw it in your dustbin. So just be mindful if you do it to, dispose of it correctly.
okay, that's quite interesting. I think also an important thing is that oil pulling is not a substitute, obviously, for your normal oral hygiene practices. You can use it in addition, but not in place of.
Yes, definitely. Your basics
Okay.
always good brushing, good interdental cleaning with either floss or interdental brushes. And then
Okay.
of course the mouthwash is an extra thing if you, and the tongue scraping, of course.
Yes.
But the mouthwash, people enjoy a minty flavor because it makes them feel fresh, but it doesn't normally mean that you're actually doing anything because it's just a mint flavor. So and that's where your highly flavored toothpaste actually
Mm,
gives people a false sense of clean
mm,
because
mm.
it's in their mouth, it's burning them. It's like half a minute later they feel, oh, that feels fresh. Then they stop brushing. But that's
Yes.
why I said that tooth brushing is not synonymous with teeth cleaning. So
Yes.
so if you get used to brushing with the toothpaste, I recently had it because I don't use toothpaste that's highly flavored. And I bought, because mine ran out, and I've just bought an over-the-counter one, and I'm not going to mention names, but it's everybody's favorite.
Mm.
And so I don't need to spell it out. I think if you ask any patient what they use, they'll tell you that one. And
Yes.
so and when I put it in my mouth, it burnt like crazy because
Oh gosh.
my mouth had gotten used to using a natural product that doesn't
Yes.
have all the added stuff in it. And
Yes.
so you actually train your mouth, you train your brain to understand that a clean mouth doesn't have to taste like peppermint.
Yes.
Yeah,
Absolutely.
clean
Yes.
mouth is a healthy mouth, and with that comes no bad odor, with no bad taste on your tongue. So it's a different mindset that you have to get your patients into, and it takes training. You have to
Mm.
make them understand it's not going to happen overnight. So every time you see them, you encourage them to make small changes.
Yes, yes. And I actually think of my own kids because when it comes to toothpaste, that's the first thing that we have to consider. So we buy them a certain brand of toothpaste, and I think there's two flavors. There's a watermelon and a strawberry, and now we have to smell each one to decide which one we want to
Right.
get.
Mm. And
Anyway, thank you
actually,
so much. I think, yeah, this information has really been very valuable. And yeah, we are just so grateful for you giving us your time and expertise in sharing this information with us.
thank you, Tanesh. Thank you very much for having me.
Thank you. Have a lovely day.
Thank you, you too. Bye.
Bye.